Hi, Grace. My name is Christine. I'm going to be your telehealth nurse of the day. I'm glad that we could connect today. How are you doing?
Hi, Christine. Me and Mona are doing well. Thank you for asking. How are you?
I'm doing pretty good. Just going through lots of things. And I also see that you've reached out an email about me about the flu vaccine, and I would love to go over all the education that you needed and address any of the concerns that you might have. Is that all right with you?
Sounds good. Yeah, I just want to make sure it's safe and necessary for my child, Mona, who is only just 6 months old.
Yeah, so about the flu vaccine helps protect against a disease called influenza, which is a type of virus that can cause fever, a cough, sore throat, body aches, and even in worst case scenarios, a bacterial infection of the lungs called pneumonia. And every year the flu changes very slightly, which is why the vaccine gets updated every year to provide the best protection. And since Mona is currently 6 months old, it is best recommended for her that she should get 2 doses of the flu vaccine, and then but both separate than once at all at your one appointment. So it's like your first dose should be administered and have a 4 week wait before your second dose. So yeah, and and that's all like according to the United States Centers of Disease Control, also known as CDC.
Really? I've heard people say that the flu shot can actually give you the flu. Is that true?
I would say that's a common concern that a lot of people like think about, and but I can assure you that the flu vaccine does not give you the flu. Like the vaccine is supposed to give your child of a small protein or like a inactivated virus that would like get absorbed and then like help build that protection, like basically building immunity. And the child might feel like have some mild side effects like a sore arm or a slight fever or tiredness, but that's just the body's natural way to build up immunity for the flu.
I see. I've also heard that the flu shot doesn't always work. What if my little Mona still gets sick?
That's a good point, Miss Grace. I would say like no vaccine is 100% effective, but even if someone who gets the flu with the vaccine, they have a better chance of like basically adapting to it better that compared to the people who don't have the flu vaccine, and they would be more prone to getting lots of complications from influenza. But it's just always like getting vaccinated in general, especially for babies like Mona and like older adults, are like they need that better protection.
That makes sense. So when or like how can I schedule the flu vaccine for Mona now?
Well, I'm very glad that you're considering of like having your child Mona getting the flu vaccine. All you have to do is just schedule an appointment at xxx.org, and I can send you the link of the nearest place to get those flu vaccines, like for those 2 doses for Mona. All she has to do is just get it on her arm, and then boom, all done. And do you have any other questions, Miss Grace?
No, I think you did a good job and covered everything. Thank you so much.
You're welcome. Have a good day. Bye.
Thank you, you too. Bye-bye. Bye.
Bye.